Hello friends, welcome to my channel called MedRecall by Dr. Sonali. Today's our topic is lymphoid tissue. Okay, let's start with our day with a positive word which is grow. Grow in your life from your past, grow from your bad habits to better habits and grow for more success and more money. Let's start with lymphoid tissue. So, lymphoid tissue is specialized connective tissue which is rich in lymphocytes. Okay, it is rich in lymphocytes. Its role is defense, immune response, and lymphocyte production. Okay, so let's start with the classification. So, lymphoid tissue is classified in two types, which is primary, also known as central, and secondary, which is also known as peripheral. Let's begin with what is primary lymphoid tissue. So it is the site of lymphocyte production and maturation. Primary, okay. So it includes bone marrow and thymus. In bone marrow, B cells and T cells both are produced, but B cells get matured in bone marrow, which are responsible for humoral immunity, and in thymus, T cells get matured, which are responsible for cell mediated immunity. Okay, so these are important things to remember. And what is the secondary lymphoid tissue? It is also known as peripheral site of lymphoid tissue. It is the site of antigen exposure and immune response. Okay, please pay attention here. In secondary lymphoid tissue, there is no production of lymphocytes. Okay, but it is a site of antigen exposure and immune response. It includes lymph nodes, spleen, and malt. Malt is nothing but mucosa associated lymphoid tissue, which includes tonsils, Peyer's patches, and appendix, and galt. Galt is nothing but gastric associated lymphoid tissue. Okay, so this is a diagram which shows location of some lymphatic tissue. So this is thymus, then spleen, axillary lymph nodes, tonsils, cervical lymph nodes here, and this is lymphatic ducts, thoracic duct. These are lymphatic and thoracic ducts, and these are lymph nodes and cisternae chyli. The difference between primary lymphoid tissue and secondary lymphoid tissue. So primary lymphoid tissue is the site of lymphocyte formation and maturation, whereas secondary lymphoid tissue is the site of lymphocyte activation and immune response. Okay, then primary lymphoid tissue examples are bone marrow and thymus, whereas in secondary lymphoid tissue the examples are lymph nodes, spleen, malt, tonsils, Peyer's patches, and appendix. Primary lymphoid tissue, lymphocytes do not meet antigen, whereas in secondary lymphoid tissue lymphocytes meet antigens, means there is exposure to antigens in case of secondary lymphoid tissues only. Now it is very important to know what is the function of primary lymphoid tissue. It makes immunocompetent cells, which are also known as stem cells. So primary lymphoid tissue is the important and active site of stem cell production, whereas secondary lymphoid tissue, it start immune reaction, but there is no stem cell production. Okay, remember this. Primary lymphoid tissue active mainly in early life. Thymus involves later, because thymus in adolescents get degenerated, है ना? Then in secondary lymphoid tissue is active throughout the life. So let's see some of the examples. Primary lymphoid tissue is bone marrow, and this is a diagram of bone marrow. It is the inside portion of a bone, and these are the blood vessels, red marrow, compact bone, articular cartilage, and this yellow marrow. So bone marrow is the site of active production of cells, stem cells, which are later giving rise to B cells and T cells, which are important for antibody production, and red cells, WBC precursor, and all these things, which you will come to know in pathology and physiology as well. In primary lymphatic tissue, we saw bone marrow and thymus. So what is thymus? Thymus is an organ. It is a diagram of thymus. It is showing this capsule, then interlobular septum, lymphatic duct, vein, artery, cortex, thymic capsule, and medulla. So Thymus has multiple lobules. Okay, it has multiple lobules, multiple cortex also. At periphery, it is dark colored. When you come to know, when you look at when you look at its histopath diagram, you will come to know that its peripheral structure is darker. Okay, it is bluish purplish. Okay, and its central part is somewhat pale, lighter in color as compared to the outer cortex. So the cortex at periphery is dark color and medulla at center which is light colored. Okay, this is the medulla which is at center which is lightly stained, whereas the cortex is darkly stained. So let's see some important features of thymus. So thymus is composed of Hassel's corpuscles. Okay, it is very important. Hassel's corpuscles are nothing but clusters of TEC. TEC is thymic epithelial cells. Okay, thymic epithelial cells क्या होता है? So these are clusters of epithelial cells which are unique to thymus, and it has concentric lamellas. They increase in number and size as age increases. सो हैसेल्स कार्पस्कल में जो थाइमिक एपिथेलियल सेल्स होते हैं, दे आर रिस्पॉन्सिबल फॉर द स्ट्रक्चरल फ्रेमवर्क ऑफ द थाइमस, आर ऑल्सो रिस्पॉन्सिबल फॉर मैचुरेशन ऑफ टी सेल्स, टी लिम्फोसाइट्स. This is diagram showing Hassel's corpuscle. Okay, it looks like rosebuds. Then look into some clinical points related to thymus. DiGeorge syndrome. DiGeorge syndrome. In DiGeorge syndrome, thymus is absent. Therefore, cell-mediated immunity decreases, which is responsible for severe bacterial infection. If a person does not have thymus, it means automatically T cell maturation will be hampered. Therefore, in DiGeorge syndrome, there will be no T cell mediated immunity to that person. So, the person is prone to more severe bacterial infections. Then what is thymoma? Thymoma is associated with myasthenia gravis and pure red cell aplasia. Anterior mediastinal tumor in adults can cause superior vena cava syndrome due to compression. Okay, so thymoma is nothing but a mass which is because of overgrowth of thymus gland. Okay, and it is associated with myasthenia gravis and pure red cell aplasia. And when the tumor outgrows, it gets bigger in size, and therefore it can compress the vessel surrounding it, which is a superior vena cava. Therefore, it can also cause superior vena cava syndrome node. So this is an outline of lymph node. It is consist of cortex, then paracortex. This is cortex, this yellow, and this pinkish is paracortex. Then medulla, which is this reddish color, is medulla, and this hilum. Hilum is the entry and exit point. Okay, so from here efferent lymphatic vessels, artery and veins enter and leave. Okay, so these are trabecules. This greenish insertions are nothing but trabecules. So afferent is those things which are taken towards the organ. Okay, towards the organ. And efferent means things are taken away from organ. Okay, so let's see the histopath diagram. So look at this. So this is a lymph node. It shows cortex, then medulla inside the cortex. It also contains some vessels, then follicles. These are follicles. Also germinal center. So lymph node is the only organ with afferent and efferent lymphatics. Its capsule is made up of dense connective tissue and it sends trabeculae inside. Okay, let's see here. Let's see here. So these are trabeculae, which are the nothing but extension of the capsules. So it helps in dividing the lymph node, है ना? In cortex, there is B cell maturation takes place. Okay, it is outer layer where lymphoid follicles, germinal centers form after antigen stimulation. What is paracortex? In paracortex, it contains high endothelial venules for lymphocyte entry from blood. Then medulla. In medulla, which is the innermost part, which is innermost portion, there are cords. Cords contain lymphocytes, plasma cells and macrophages. Then medullary sinuses, these are nothing but channels for lymph lined by macrophages. Sinuses are nothing but channels through which lymph flows. What is the function of lymph node? So it filtrates lymph. It is a site of antigen presentation and immune response, and also produces lymphocytes and antibodies. Very important function. Okay. It filtrates lymph and it is also an active site of antigen presentation and immune response, and it also produces lymphocytes and antibodies. So this is a diagram of spleen section. It shows capsule. It has red pulp and white pulp. Okay. Spleen is divided into red pulp and white pulp. Then splenic artery, vein, trabecules, venous sinuses and follicles. Okay. Again, like lymph nodes, spleen is also having a capsule which sends trabecule inside. It has a red pulp and white pulp. So let's see, what does the white pulp contain. So white pulp forms 10 to 30% of the spleen. It gives rise to more WBC production as lymphoid follicles with germinal center. Look at this white pulp. Okay, this image is also showing the white pulp, and this other surrounding this white pulp is red pulp. So in white pulp and also in this histopath, you can see this round structure, this structure which is marked with interrupted lines. It is nothing but white pulp, and the matrix is red pulp. Okay, so in white pulp, the lymphoid follicles with center contains B lymphocytes, and periphery darker area is T lymphocytes. This white pulp contains central germinal center which is lighter in color, and periphery there is darker color. Okay, so at center there is production of, so in the center, which is a light colored area, there is B lymphocyte maturation which happens, and in periphery T lymphocytes will get matured, and in center B lymphocytes get matured. Red pulp occupies 70 to 90% of the portion of spleen, and it is helpful and it produces more RBCs. It contains splenic sinusoids which are filled with blood. Okay, so red pulp is made up of splenic sinusoids which is filled with blood, whereas white pulp was made up of B lymphocytes and T lymphocytes. So cords of Billroth, these are nothing but some specialized reticular tissue. These are cords of reticular tissues which contains blood cells, RBCs, WBCs, platelets, and they facilitate blood filtration, act as a reservoir for blood cells. So cords of Billroth are found in red pulp. Okay, cords of Billroth are found in red pulp. Whereas what are the central arteriole? So central arteriole is present in lymphoid follicle, and they are eccentric and they are surrounded by T lymphocytes. This is the place where central arteriole must be present, and they are surrounded by these T lymphocytes. This darker area which shows T lymphocytes. Next is MALT. MALT is mucosa associated lymphoid tissue, which includes tonsils, which are pharyngeal tonsils, tubal tonsils, palatine tonsils, and lingual tonsils. And then it also includes Peyer's patches, which are associated with ileum of small intestine. This is the location of tonsil, and this is the histology diagram of tonsil. This is the cortex also. It shows some little cortex. Tonsillar crypts are lined by non-keratinized stratified squamous epithelium. So this can be an MCQ point. Okay. So these are crypts, and these are lined by non-keratinized stratified squamous epithelium. Then come to Peyer's patches. So this is also a lymphoid organ, secondary lymphoid organ. Okay. If there is any antigen stimulation, then what will happen? Immune reaction will start here. Then what is Peyer's patches? Okay. So this is the mucosa and this is submucosa. Okay. These and Peyer's patches are nothing but patches of lymphoid tissue which is present between mucosa and submucosa in ileum of the small intestine. Okay, these bluish collections of lymphocytes between mucosa and submucosa are nothing but Peyer's patches. These are aggregated lymphoid nodules in mucosa and submucosa of small intestine, mainly in ileum, part of gall. It is also a part of gastric associated lymphoid tissue. And some clinical points regarding this Peyer's patches are: if enlarged Peyer's patches, it acts as a leading point in intussusception in children. Intussusception means there is telescoping of intestines, means one part of intestine get hooked in another part of the intestine. For example, the distal part of intestine will move inside the proximal part of the intestine. Okay, it appears like a telescoping. This part of the intestine will move backward. So sometimes this enlarged Peyer's patches can act as a leading point which can cause intussusception in children. And entry point for Salmonella typhi infection also. Salmonella typhi can infect via Peyer's patches. Okay, so now another example of GALT is gut associated lymphoid tissue is appendix. In appendix histology also you can see there are patches of lymphoid tissues here which are similar to Peyer's patches, but it is called as GALT. It is present in lamina propria. And Peyer's patches were present between mucosa and submucosa, but this GALT in appendix is present in lamina propria. This is a difference. So this was our small discussion on types of lymphoid tissue. Watch it, like it, subscribe my channel and share with your friends. Follow for more. Thank you. Bye.